calls to 111, and it became quite a frustrating process, really. Lots of different advice from different people. I have an abscess on my tooth, I think, quite a swelling on my gum. I would consider that an emergency, but that didn't appear to be the case.
Oh, it's clearly some desperate situations. Let's speak now to Eddie Crouch, Vice President of the British Dental Association, and dentist Dr. Kunal Patel. Morning, both. Thank you very much indeed for joining us. Let's speak to you first of all, Kunal. What sort of, I mean, those stories are really terrible for people. What sort of things are you hearing?
Yeah, I mean, it's a daily occurrence, 5 to 10 patients in my size clinic a day. And it's really upsetting. I mean, the last time I was on the show was about 6 weeks ago. And it was at the time where we were asked to stop physical contact with our patients and just triage over the telephone. Unfortunately, dentistry hasn't bounced back since, even though the science possibly is saying that it could be safe for us and it should be safe for us to return. Because as most people know, you never go to the dentist without him wearing a mask, proper PPE, gloves, visors, etc. So, I think it's sad every day to hear these patients suffering, knowing that we can safely treat these patients, and especially if they're starting to take dentistry into their own hands, there are large risks associated with that.
Eddie, what are your concerns, sort of your major areas of concern for the dental industry at the moment?
Well, I think that the big concern is really what dentistry will look like going forwards. Many of my colleagues rely really on a mixture of NHS and private treatments to subsidise the care for their patients. And really, the support for private practice is really worrying at the moment. And my concern is what the NHS will have to put up with following this virus problem that we have, because many NHS practices were struggling before this. And if many private practices go out of business, I'm really worried for the service that's going to be there for patients in the future.
What you mean, not being able to get appointments, fewer dental practices around, and essentially a system which, if you've got the money, you'll be able to get care, but you won't otherwise? It's
such a complex situation, really. I mean, dentistry going forwards, we will be able to see far fewer patients with the cross-infection procedures that we need to carry out. Dentistry will become more expensive for the government to deliver through the NHS, and it will become more expensive for my colleagues in private practice to deliver. And we need help and support now to make sure that those practices survive.
Can I just ask you as well, Kunal, so, I mean, if someone's got a problem, they are meant to be able to go and get emergency treatment. Is that accessible? Is it happening?
Yes. OK, so if we imagine 10 to 12,000 dental clinics were shut down 6 weeks ago, there were urgent dental care hubs, which I spoke about back then, that were opening up. And we were hopeful that a lot more would have been opened up. We have an estimate of about 200 for the entire England population. Unfortunately, that is not going to be sufficient. So when we're getting these calls every day, we are strictly triaging them. And if you can imagine, I don't know if you've ever had tooth pain, but to be told your tooth pain isn't severe enough and the only thing that we can do is advice or painkillers or antibiotics, which we know most likely isn't going to help the cause, it's quite frustrating for you as a patient in pain to be told your pain isn't sufficient enough. However, you are safe to go and see, your local takeaway shop for a takeaway. But, your dentist, who is gowned and protected and has always had the best levels of PPE and cross-infection as a norm, isn't available to you. And you may have to be triaged approximately 3 times down the chain to then possibly be seen by an urgent dental care hub. And it's getting to the point where, there's highly skilled professionals like myself all sitting at home, trying to dress up in our tunics at home, just on the phone, just trying to make ourselves feel as if we're doing the right duty when we know deep down we could be doing a lot more. I mean, my own dental nurse yesterday broke her tooth and she's pregnant at the moment. And it's sad to know that she has to stay in pain and suffer, even though me and her both know that quite safely we will be able to we could provide a treatment for her. But the law is stating that we cannot.
A lot of people will know about that pain. I think last time I cried was when I had an abscess. It was, unbearable. And thankfully, it was at a time where you were able to get emergency dental care. Eddie, to come back to you, on that sort of provision of those urgent care hubs, is that a system which is functioning?
In some parts of the country, yes. In other parts of the country, no. And it depends really on how easy it's been to set them up and to access the PPE. I mean, some of my colleagues have almost all the right PPE, but are missing one essential component, which means that they're limited to what they can provide for their patients. It's the aerosols that we produce in dentistry for the vast majority of our treatment that needs the best PPE that's available, and many of those clinics don't have that.
So the Prime Minister, we know, is going to be making a speech on Sunday. We don't know what's going to be in that speech, but are you hoping, Eddie Crouch, that there will be, we might be able to get back to dentists, for example?
Oh, absolutely. I mean, many of my colleagues are desperate, like the speaker there, to get back and help patients. That's what we do. We look after our patients. That's what we want to do, but we want to do it safely. And we want to do it safely, not only for us and our staff, but for the patients that are coming through the practice.
Kunal, are you hearing more stories about people taking things into their own hands?
Yes, I mean, most recently, I think we all heard about this gentleman who decided to extract and pull out his own tooth. I mean, that should resonate through the government to say, look, yes, we understood, we close down our clinics for the better good of the nation. We had to stay home at that moment in time, protect the NHS and save lives. Now, time has passed. Now we're over the peak, and it's not, I don't think the concern if people are able to travel. I think it was never the concern of people traveling. Being treated in our clinics is more them traveling to our clinics. Within our clinics, I know Eddie mentioned aerosols, but aerosols has been there forever. I mean, as dental clinicians, we've always taken viruses and things like that into our highest consideration to our daily lives. And I think the urgent dental care hubs, to go on to the question asked, I think, are they sufficient? The numbers, no. I think the colleagues I've spoken to, they've had to self-fund their PPE and self-source their PPE. And if that's the case and NHS isn't able to provide it all themselves, however, we can source it ourselves, then a lot of our clinics, I mean, in my area, it's so upsetting that we don't have an urgent dental care hub. And every day we're having to tell patients, they don't qualify for the hub. And if they do, they then have to travel over an hour to see an urgent dentist in pain, when we know as professionals we most likely could safely provide treatment. I know things have to change in our waiting area. Social distancing has to be done, pre-screening a patient before they come in. But we're willing to make these changes. And I think every day that goes by without seeing these patients and leaving them in pain is a day that is something that we won't get back, and it's quite upsetting.
Really good to talk to both of you this morning. Eddie, Kunal, thank you. I've got to say, can I just commend you both on your backdrops? Eddie, your stained glass window is very impressive. And Kunal, it looks like you're in a spaceship.
Yeah, I mean, I'm locked in my roof. It's not as glamorous as it looks.
Very impressive. It's like Flight of the Navigator. Thank you very much.
Thank you both very much. When Captain Tom Moore raised more than 30